Every physical therapist enters the field to help people to make a big difference in a way that's personally meaningful, not only to the patients, but themselves. Where you practice will determine to a great extent of how you practice. It can make a big difference in helping you to achieve your career goals. Let's dive into the pros and cons of a couple of different practice settings so that you can understand which ones align with your values, skills, and long-term vision. So there's a distinction between traditional physical therapy clinics in which there's a reliance on physician referrals. These are oftentimes part of hospital and systems that are dictated by physician referral and directed only by those interactions. So there's some advantages to that. There's a steady flow of patients from an established referral networks, and you have the opportunity to work pretty directly with the medical teams, and you have an access to electronic medical records fairly seamlessly. A couple challenges in those settings are there's limited autonomy in some decision making. For instance, I've seen patients be directed towards tests, imagery, and surgical considerations that aren't necessarily in alignment with conservative intervention, and their power and influence dictate and can overwhelm the conservative recommendations that physical therapists would give. There's another disadvantage to having patients from a direct referral. The motivation level may be different. In other words, oftentimes in private practice settings or independent freestanding clinics, the patients are much more motivated because they've sought out and they've self-selected to opt in for treatment, and or the clinic has done so much communication and goodwill in the community that they're recognizable to that person based on the merits of the treatments there. So direct access, by comparison, is one in which people can come to without physician referral. There's still collaboration with medical teams as appropriate, but those settings don't require direct physician referral for initiation of care for the most part. So the great advantage of that is a doctor of physical therapy in those settings practices like a true clinical doctor and is able to drive that autonomy and decision making that enables them to feel more empowered. It also allows doctor of physical therapy to develop relationships for retention of those patients and relationships in the community to drive interest for folks coming to that clinic. Some challenges in a direct access setting are it requires strong, influential conversations at times to help that individual come back and stay on schedule and to maintain patient flow. That's true in all settings, but it's particularly true in private practice because we need patients to be in those settings to be champions of that practice so they can refer other patients, because referral and word of mouth is real strong in those settings. There's also a much greater responsibility in assessing and diagnosing conditions with necessity to triage and to reach out to the greater medical community as needed. So it's a balance between greater autonomy, feeling like a doctor, but also greater responsibility. The motivational level in patients is palpable at times, because when patients choose to go to a person or a clinic, they're much more likely to be heavily involved in their care, and that will reflect in a much more motivated client, in my experience. Traditional referral-based settings may include patients who have little interest in being there or are just kind of buying their time until they get the next test or procedure, or less engagement because they were just advised to go downstairs or go to that clinic. So you have to reflect and ask yourself, do I prefer to be someone who practices in an autonomous setting with the responsibility of developing strong relationships and having terrific communication that helps patients to see the value of coming to see us? And do I really value that extra work in order to have patients who are at times much more motivated to come to see us to begin with? Direct access also allows you to engage in the community with community events and educational and outreach opportunities to both providers and the community at large. For example, might host more injury prevention workshops, partner with local gyms or wellness programs, and these activities help build your professional reputation and your skills to go out and promote the field of physical therapy in a setting in which there is the necessity for that versus an abundance of patients coming in by self-referral. So it's basically up to you if you want to work more where you use your opportunities to develop those public speaking and engagement skills, or if you're more comfortable working within a system. So, in summary, you want to think about different practice settings in which there's varying levels of autonomy and different levels of motivation and or activities to drive more customers to come and see you. Referral practices tend to be built upon the referrals relationships of a few, and direct access practices tend to rely on the communication more one-on-one and in the community engagement. So you want to take a look at a couple different practice settings and kind of understand distinctions between them. What excites you about that setting and what challenges might you face? Again, I mentioned that there's pros and cons to each type of setting, and every setting has its particular strengths and weaknesses. The key is to find one that fits your personality, skills, career goals, and aptitudes, and the aptitudes you want to build. So, research a couple facilities, understand which ones for you might lead to greater growth, greater opportunities for you, and allow you to excel as a clinician. Regardless of where you're at in your career search, whether you're just starting out looking for your first clinical, or you're canvassing for your first job opportunities, or currently entertaining job offers, or even if you already have an accepted job offer and are already in place with that, I'm happy to help to support you in your professional journey. Feel free to reach out at me at eric@pacptot.com, Eric, E-R-I-C, at pacptot.com, or give me a text at 920-289-8564. I'd be happy to assist you and look forward to helping you in getting to your next best step and supporting you. If you're watching this video, you'll be receiving a text with a link to valuable resources that are supplement to this discussion. Thank you. I look forward to seeing you next time.